Nail warning signs. Nails are more than just a canvas for nail art or a tool for scratching. They can serve as an indicator of overall health. Changes in the color, texture, shape, or growth pattern of your nails can sometimes signal underlying health issues. Being aware of these warning signs can help you detect health problems early and seek appropriate medical advice. This video will drill into various nail danger signs, their potential causes, and what they could indicate about your health. The anatomy of your nails. Before delving into specific warning signs, it's important to understand the basic anatomy of your nails. Nails are made up of several parts. Nail plate, the hard, visible part of the nail. Nail bed, the skin beneath the nail plate. Cuticle, the tissue that overlaps the base of the nail plate. Nail matrix, the hidden part of the nail under the cuticle, responsible for producing new nail cells. Lunula, the whitish, half-moon shape at the nail's base. Nail folds, the skin that frames each nail. Common nail danger signs. Discoloration. Changes in nail color can be one of the most noticeable signs of an underlying health issue. Yellow nails. Possible causes: fungal infections, psoriasis, chronic bronchitis, lymphedema, or as a side effect of certain medications. What it indicates: persistent yellow nails may suggest lung problems, diabetes, or thyroid issues. White nails. Possible causes: trauma to the nail, fungal infections, or more serious conditions like liver disease. What it indicates: white spots, leukonychia, are usually harmless and often caused by minor injuries, but fully white nails can indicate liver issues such as cirrhosis or hepatitis. Blue nails. Possible causes: cyanosis due to lack of oxygen in the blood, which can be caused by respiratory or cardiovascular issues. What it indicates: conditions like chronic obstructive pulmonary disease, COPD, asthma, or heart conditions. Black or brown nails. Possible causes: trauma to the nail, subungual hematoma, fungal infections, or melanoma. What it indicates: a sudden dark streak or spot under the nail should be evaluated by a healthcare provider to rule out melanoma, a type of skin cancer. Texture changes. Changes in the texture of your nails can also signal health issues. Brittle or cracked nails. Possible causes: overexposure to water or chemicals, nutritional deficiencies, thyroid disorders. What it indicates: brittle nails may suggest iron deficiency anemia, hypothyroidism, or lack of vitamins and minerals like biotin and zinc. Pitted nails. Possible causes: psoriasis, eczema, or alopecia areata. What it indicates: pitting, small depressions on the nail surface, is often associated with psoriasis, an autoimmune condition that affects the skin. Ridges, vertical or horizontal. Possible causes: aging, trauma, malnutrition, or underlying medical conditions. What it indicates: vertical ridges are often normal and related to aging, but horizontal ridges, Bowes lines, can indicate severe malnutrition, uncontrolled diabetes, circulatory issues, or acute illnesses. Shape and thickness changes. Alterations in the shape and thickness of your nails can be indicative of various health problems. Clubbing. Possible causes: low oxygen levels in the blood, lung disease, heart disease, liver disease, inflammatory bowel disease. What it indicates: clubbing, characterized by the enlargement of the fingertips and the nails curving around the fingertips, is often associated with chronic respiratory or cardiovascular conditions. Spoon nails. Koilonychia. Possible causes: iron deficiency anemia, liver condition known as hemochromatosis, heart disease, or hypothyroidism. What it indicates: spoon-shaped nails that curve up at the edges can be a sign of iron deficiency or other underlying health conditions. Thickened nails. Possible causes: fungal infections, psoriasis, reactive arthritis, or poor circulation. What it indicates: thickened nails are often due to fungal infections, but they can also indicate underlying skin conditions or circulatory issues. Nail separation. Onycholysis. Possible causes: trauma, fungal infections, psoriasis, thyroid disease, or reaction to medications. What it indicates: when the nail separates from the nail bed, it can be a sign of injury or infection, but also systemic conditions like thyroid disease. Less common but serious nail conditions. While the above changes are more common, there are other less frequent but serious nail conditions that should not be ignored. Terry's nails. Appearance. Nails appear mostly white with a narrow band of pink or red at the tip. Possible causes: liver disease, congestive heart failure, diabetes, or aging. What it indicates: Terry's nails can be a sign of severe liver disease or other serious health conditions and should be evaluated by a healthcare provider. Merca's lines. Appearance. Paired white lines that run horizontally across the nail, parallel to the lunula. Possible causes: severe illness, liver disease, kidney disease, or chemotherapy. What it indicates: Merca's lines are often a sign of low protein levels in the blood and can indicate underlying systemic diseases. Bow's lines. Appearance. Horizontal depressions or grooves across the nail. Possible causes: severe illness, uncontrolled diabetes, circulatory diseases, or malnutrition. What it indicates: Bow's lines occur when there is a temporary interruption in nail growth due to a severe illness or condition. Splinter hemorrhages. Appearance. Small, red or reddish-brown lines under the nails. Possible causes: trauma, bacterial endocarditis, vasculitis, or systemic diseases. What it indicates: splinter hemorrhages can be a result of minor trauma, but multiple occurrences can indicate a more serious underlying condition such as bacterial endocarditis. Preventive measures and when to seek medical advice. While some changes in nails can be harmless, others may require medical attention. Here are some preventive measures and guidelines on when to seek medical advice. Preventive measures. Maintain good nail hygiene. Keep your nails clean and trimmed to prevent infections. Protect your nails. Wear gloves when using harsh chemicals or doing tasks that could damage your nails. Moisturize. Use moisturizers and nail oils to keep your nails and cuticles hydrated. Avoid biting your nails. Nail biting can lead to infections and damage to the nail bed. Eat a balanced diet. Ensure your diet includes essential nutrients like biotin, vitamins, and minerals to promote healthy nail growth. Limit exposure to water. Prolonged exposure to water can weaken your nails. Use gloves while doing dishes or cleaning. When to seek medical advice. Persistent changes. If you notice persistent or unexplained changes in your nails that don't improve with basic care, consult a healthcare provider. Pain or discomfort. If your nail changes are accompanied by pain, swelling, or redness, it could indicate an infection or other serious condition. Sudden changes. Sudden changes in nail color, shape, or texture should be evaluated promptly. Systemic symptoms. If you experience systemic symptoms such as fatigue, weight loss, or difficulty breathing along with nail changes, seek medical attention as these could indicate a more serious underlying condition. Your nails can provide valuable insights into your overall health. By paying attention to changes in color, texture, shape, and growth patterns, you can detect potential health issues early. While some changes may be harmless and temporary, others can be indicative of more serious conditions that require medical attention. Maintaining good nail hygiene, protecting your nails, and ensuring a balanced diet can help promote healthy nails. If you notice persistent, sudden, or painful changes in your nails, it's important to consult a healthcare provider for a thorough evaluation and appropriate treatment. If you received value from this video, please like and subscribe to the channel.